Healthy Wednesdays, brought to you by the sponsors of momseveryday.com.
Every pregnancy brings a variety of symptoms, some expected and some unexpected. I'm here with Dr. Petra Razdan from Allergy, Asthma and Immunology Associates to talk about asthma and rhinitis during pregnancy. Hi, doctor.
Hi, how are you?
Good to have you here. I know if you are an expectant mother, you are worried about what you can put in your body and what you shouldn't. And so let's talk about if you do have rhinitis during pregnancy, how should you handle it?
Well, rhinitis of pregnancy, sometimes you can have allergic rhinitis or you can have rhinitis that just starts when you're pregnant. It affects about 30% of women, and it is more related to the hormones that are elevated during your pregnancy. So the treatment is a little bit different. Usually with allergic rhinitis, we'll use intranasal steroids and such, but rhinitis of pregnancy, not related to allergies, are quite resistant to intranasal steroids. So you'll have to use more of an antihistamine, you can use nasal saline, and low doses of oral decongestants.
Okay, so you can just develop that while you're pregnant.
Yes, you can.
Then it will go away once you have the baby?
48 hours after delivery, it's usually gone.
Wow, okay. So what happens with asthma during pregnancy?
Well, asthma during pregnancy can be quite tricky because your body obviously changes. You'll have a much larger abdomen as your uterus ascends inside your trunk, and you will have a lower total lung volume. And it's about a rule of thirds. 1/3 stay the same, 1/3 will improve, and 1/3 will worsen.
Okay, so which medications are safe then to use during pregnancy?
Well, there's a list between A through X that's been regulated by the FDA. A is most likely your prenatal vitamins, is completely safe.
Right.
B is that nothing has really been shown in humans, and C is that it hasn't been shown by control studies in humans, but is usually used by us. So class B, for example, is your Singulair or Montelukast that a lot of people are on right now for their allergies. And also, for example, you can use budesonide, which is one of the inhaled steroids or intranasal steroids. It is class B. And class C is, for example, your albuterol, your long-acting beta agonist, that's part of Advair and Symbicort. And class C is also oral corticosteroids.
So you can do a class B during pregnancy?
You can do a class B. And we actually use class C also. There has to be a risk and benefit that you talk to your patient. It's very important for your patient to maintain asthma control. Severe asthma has been linked to both premature birth, low birth weight, and severe complications during pregnancy. It's important to stay on top of your asthma symptoms.
And you want to feel comfortable
Absolutely.
when you're pregnant. Can you have allergy shots if you're pregnant?
Yes, you can. Generally, if you come into our clinic, it's not recommended to be allergy tested and initiate the shots. However, if you are a patient of ours, you become pregnant, that's great. You can be maintained on that dose that you were on at that point in time. You won't increase the concentration of the vial, but we'll keep you at the same dose throughout the pregnancy.
Okay. Thank you,
Thank
Doctor.
you.
Yes, and for more information on asthma during pregnancy, go to momseveryday.com, find the health button, and click on the Allergy, Asthma and Immunology Associates page.
Moms Every Day, weekdays at 8:55 a.m. is brought to you by the sponsors of momseveryday.com.